In this chapter of The Answered Patient on Diabetes, we'll discuss some of the symptoms you should be aware of and the tests your doctor will use to determine whether you have this disease.
Well, we're here to revisit, see what's going on, see how well controlled your diabetes is.
Both type 1 and type 2 diabetes have very similar symptoms. Excessive urination and abnormal thirst are often the first symptoms of diabetes. Other symptoms can include unexplained weight loss, blurred vision, drowsiness, nausea, and a decreased endurance during exercise.
Do you know what your average blood sugar has been running?
In the 200.
Type 1 diabetes always presents in clinical practice very abruptly. So suddenly the patients start losing weight and having a lot of symptoms of fatigue and excess urination. Within a few weeks, their blood sugars are very high and they're very sick indeed.
The symptoms for type 2 diabetes are usually much more subtle.
Some days they're a little bit thirsty, and then it goes away. And we can always excuse away some of those symptoms. You know, I had too much salty food yesterday, that's why I'm thirsty. And they don't always put those things together as being part of a disease.
In order to properly diagnose any type of diabetes, you'll need to visit your doctor.
It's estimated that about a third of all patients with actual definite diagnosable type 2 diabetes today are just out there in the U.S., totally undiagnosed, walking around, elevated blood sugars, and no one's the wiser.
There are several tests used to diagnose diabetes, but the one used most commonly is the fasting plasma glucose test. Blood sugar levels are tested in the morning after an overnight fast. While this is the most commonly used test, there are other tests tailored for pregnant women who may have gestational diabetes and for the elderly. In general, diabetes is diagnosed if blood glucose levels are greater than 125 milligrams per deciliter. Normal blood glucose levels in non-diabetics are 99 milligrams or less. Patients with blood glucose levels between 100 and 125 milligrams per deciliter are considered pre-diabetic and are at high risk of developing diabetes.
Well, my family has a history of diabetes.
Some of the most common risk factors for developing diabetes are obesity and heredity. If you have either of these risk factors for diabetes, you should have your blood sugar checked periodically after the age of 45.
As time goes on, I think we're trying to diagnose people earlier and earlier.
Mild diabetes may seem mild in terms of the elevation and the extent of elevation of the blood sugar. It can still cause a considerable amount of damage to your organs, especially your nerves, your kidneys, your eyes, and your heart, and your vascular system.
The experts say it is possible to successfully manage and even prevent type 2 diabetes. For all types of diabetes, the key is knowing and controlling your blood sugar levels. The most important steps to take are to get your weight to a healthy level through an effective diet and exercise plan.